Hello everyone, myself Dr. Monalisa, and today we are starting with the topic of common mistakes and commonly asked questions in the anatomy. So firstly, I would like to elaborate about the common mistake which is usually done by the aspirants during the examination and before the examination. And thereafter we will proceed with the commonly asked anatomy MCQs targeting NEET PG 2021. So we are targeting which examination? We are targeting NEET PG 2021. So yes, all the best students. So let's start with the discussion. So before starting the topic, I would like to tell you about myself. Myself Dr. Monalisa. I have done my MD Anatomy from Armed Force Medical College, Pune, and has got approximately 8 years of teaching experience. So let's start with the discussion. Now, common mistakes which is generally seen the students and the aspirants do in their examination period of preparation is that, and also during their examination, is that always when they are preparing for the examination, before that examination, few months before and all, that they will make a elaborate notes taking information from many sources. So what happens, they are keep on adding their notes, and just before their examination, when the final revision is required, they are not able to revise it. And they feel that it's their mistake that they are not able to correctly mark the answer. But because when they come back to their home and they check their notes, what they see that the questions are from their notes itself. The thing is that always keep on making in notes which is in concise manner that you can revise before your examination. Next important point is that the revision, that is 1 or 2 revision, is not enough for cracking the examination. If you want a good rank, you have to at least give 4 to 5 revisions before the examination date, and that requires more of studying and more of dedication and more of revision. So that would be only possible if you make your notes in a concise manner. So what happens, you keep on adding, so go for subtraction, and most important points will be there and it should be highlighted so that you can revise before the examination. The next important point which I want to add on is generally what happens, it's the trend of examination is like that 50 to 60% questions are the usual commonly asked MCQs. So please don't leave any of the commonly asked MCQs. So we are starting with this session on the Let's Crack NEET PG platform, where all the subjects commonly asked MCQs will be discussed. I will elaborate about the anatomy MCQs asked. So common asked MCQs should not be marked wrong, so it should be right always. So that will be done only if you keep on revising. Okay, so that is important, not make any mistake in the commonly asked MCQ which has been asked in the past 5-6 years. Make your notes and concise so that you can revise it 4 to 5 times before the examination date, and always follow a good educator, make good notes, and follow good books, and then you can target your examination. Don't take notes from multiple sources because you are not able to just revise at the time. So these are the common mistakes which is generally done by the students, and they feel that it's their mistake that they are not able to memorize all the things. But actually, if it is very much lengthy and elaborate, you are not able to revise it. So these are the things which should be kept in mind. So let's start with the commonly asked anatomy MCQ discussion. Before that, I want to give you the brief introduction about the platform. So first thing which I want to tell you about the platform of Unacademy is that free live classes on the Unacademy. So this is a great opportunity for the students. Grab this, okay? So you can use my code. So students who are on the YouTube channels of Let's Crack NEET PG watching this session, please don't miss the special sessions which is taken on the platform of Unacademy. So this is my code NAT10 which can be used by you for unlocking the free session. So what you have to do, you have to download the Unacademy app from the Play Store and then find your goal as NEET PG, and then you can search me Dr. Monalisa. So my all free sessions and plus courses will be there. So follow my free courses, and I would also like to give you the detail of my upcoming free session which is on Wednesday. So the upcoming free session is on Wednesday. What's the timing? It's on 11th August and the timing is 7:30 p.m. Okay, the timing is 7:30 p.m. Okay, got it? Timing is 7:30 p.m. 11th August. So be there present so that we can have this session, okay? And this will be a clinical anatomy MCQ series, okay? So be present for this session, it will be highly useful. We will quickly target more of clinical anatomy MCQ, number of MCQs I will increase. So be present, it will be highly beneficial. Use my code ANAT10 to unlock. So what you will do, you will use my code ANAT10 to unlock the free sessions on the Unacademy platform. So how you can proceed? Download the Unacademy app, find your from the Play Store, find your goal as NEET PG, and thereafter find me or any of the educator whose free session you want to see. Use my code ANAT10 for unlocking and then take part in the free sessions. I would also like to tell you about the benefits of plus courses. So the plus course is extremely beneficial as the every sessions are targeted in a respective manner. So you can access the live and recorded version both, okay? Live courses and recorded version both, what does this mean? That simultaneously number of courses live is going on. So what you can do, you can take part according to your destination, whether you want to target NEET PG, whether you want to target next examination, whether you want to target INICT, whether you want to target FMG examination. So जो भी आपका target examination है उस course को आपने join किया, you will take part in that live sessions of all 19 subjects. None of this 19 subject in that course will overlap. You can attend all the session live, have live interaction with the top educators of Unacademy platform. But at times you are not able to be present in the live session. What you can do, you can also see the recorded version. No time limitations, my dear aspirants. You can watch it 4 times, 5 times, how many times you require, that is totally dependent on you. Study on your device of choice, whether at your comfort level, from your home, from any destination of India or outside India. So that is a very great point. Have live interaction, study on your device, learn from the top educators of Unacademy platform. For a single subject, more than 4-5 educators are there. So your basic concepts or whoever you want to follow, you want to attend the session, you have got an ample of choice to make, which is not there on any other platform. Assess the QBanks, over 25,000 MCQs are there. Compete in live tests and quizzes and assess yourself along your competitors. Coming soon is the printed notes. So coming soon there is printed notes provision for the Unacademy Plus course also, and but the thing is that you have to take the subscription of more than 12 months or 1 year. So every 4th session on the Plus platform is also a doubt clearing session. So all these are the benefits which is only available on the Plus subscription. Use my code ANAT10 and avail 10% discount. Now what about Iconic subscription? Unacademy and Prep Ladder is merged. So Unacademy and Prep Ladder is merged, okay, and that is called as the Iconic subscription, where you get the benefits of both Unacademy and the Prep Ladder. You will be provided with the printed notes of Prep Ladder, clinical and integrated session video lectures from the dream team of Prep Ladder, QBank 3 with active guidance system, tags and more, rapid revision and snapshots, and Treasure 2021 dream notes. So all these points which has been mentioned here is definitely given to you. So just grab this opportunity, take Iconic subscription. The students who are preparing for NEET PG 2021 should go for Iconic subscription. So all the benefits of the Plus platform which I have elaborated, along with it the add-on benefits of the Prep Ladder is given to you. Use my code ANAT10 to get 10% discount. Now I have included the slide which is also showing you the pricing details of both the NEET PG Plus subscription and Iconic subscription. So all these pricing details has been compared. So whichever session you want to take, whichever subscription you want to take, whether Plus or Iconic, go for it. Use my code for getting 10% discount. Now 4-year subscription is the new thing which is on the platform of Unacademy. What is the usefulness of it? Means entire duration of 4 years you are able to view all the live sessions of the Unacademy, and also you are able to get the access of Prep Ladder. For both Iconic and Plus, this 4-year subscription is available. Use my code ANAT10 to get 10% discount. The usefulness is very much for the 1st and 2nd year students, because entire duration they are able to clear all their university exam along with their next examination. So I would suggest the students of 1st year and 2nd year MBBS should definitely go for the 4-year subscription. Now again this is still available is the 12-month subscription के साथ 2 month का subscription absolutely free है. So you can have this opportunity. Now the batch courses which is starting, I would like to give the information about that. Batch courses starting are 11th August batch courses. Starting from 11th August 2021, Focus FMG batch, NEET PG test and analysis batch, Target Next 2022, NEET PG Ultra Fast Track High Yield Topic Revision batch. These are the batches which is ongoing and starting from 11th August. So don't waste your time, just grab it. Take the subscription of Unacademy or Iconic, use my code NAT10 for 10% discount. Now NEET PG 1 month package also available students. So NEET PG 1 month pack you can grab it. सो 11 से 31 अगस्त के लिए आपके पास ये सारे पैकेजेस हैं. अल्ट्रा फास्ट हाई यील्ड रिविजन बैच, MCQ बैचेस, नीट पीजी टेस्ट एनालिसिस, लास्ट ईयर नीट पीजी, प्रीवियस ईयर MCQ बैच, कोविड टेस्ट and grand test series. So all these opportunities can be availed by you. So don't waste your time. You can take just 1 month of monthly subscription and this will be highly useful for targeting your NEET PG 2021 examination. Grand test scheduling. So grand test schedule, again I have included this entire timetable. So the last date of grand test 10th is 9 September and again upcoming are 7th, 14th, 21st. So just mark the dates and be the part of these grand tests. It is made by the top educators of Unacademy platform and it will be highly beneficial for you. MedGenius scholarship test. Okay, great opportunities for the students is the MedGenius scholarship test. What special number based question test and numerical questions is there? When, what is the timing when this test is going to happen? 14th August 8 PM, 1 hour. 50 MCQs, all NEET PG aspirants free test. Just see you can test your knowledge, see your competitors, and regard is the Unacademy Plus subscription is made free to you. So just grab this MedGenius scholarship test. Date 14th August, all the best students. So do present, duration is just 1 hour. Now Bucks Bounty. What is this? Bucks Bounty opportunity for all the learners to report any inappropriate content in the video. Be the first one to report a particular issue to claim your prizes, report any inappropriate content and win exciting prizes. So let's start with the session now. So let's start with the commonly asked anatomy MCQ. So what I told, so today we are discussing 10 anatomy MCQs which are commonly asked. This is the first one. Identify the mark layer in the given histological slide. Identify the mark layer in the given histological slide. Option A is outer plexiform layer, option B is inner plexiform layer, option C is outer limiting layer and option D is inner limiting layer. So mark your answer whichever you feel is correct. So yes, in this MCQ I would like to tell the correct answer here is, so firstly you have to know which layer is this. So actually in this diagram you can clearly see the rod cells. So you can clearly know this slide is showing you the layers of retina. You can clearly see that this slide is showing you the layers of retina and so you have to mark the correct layer. Actually the correct answer is A, that is outer plexiform layer. Okay, so for marking this answer correct, I would like to give you firstly the details of all the layers and then I will tell you about the individual layers of the retina. So let me just elaborate this diagram. So as you move from outside to inside, okay, so the outermost layers are just sclera and that of the suprachoroidal layers, choriocapillary layer, and below the choroid layer and choriocapillary layer, the layers are of 10 layers of the retina. Okay, so important layers which is shown here is pigment cell layer of the retina from outside to inside, layers of rods and cones, outer limiting layer, nuclei of the rods and the cones. Then so we have got this outer plexiform layer. So firstly is the outer nuclear layer, then we have got the outer plexiform layer, then the inner nuclear layer, inner plexiform layer, ganglionic cell layer, inner limiting layer. Okay, and this is all the layers which has been shown. These diagram is showing all the layers of the retina. So don't worry, I will give you elaborate distribution of all. Here you are seeing just below this nuclear layer. If in this diagram what you can target, this is the nuclear layer and just below, just a minute, yeah. So see here, very easy to identify. The next point is that very easy to identify is that this is the nuclear layer which can be easily visible. This is the another nuclear layer. So in between these nuclear layers lies the plexiform layer. So just see here, in between outer and the inner layer lies the outer plexiform layer, and below it is the inner plexiform layer. So the correct layer here you can identify here, this is the nuclear layer, this is also this is outer nuclear layer, this is the inner nuclear layer, and the layer which is residing in between, which is green arrow mark, is the outer plexiform layer. Now I would like to give you the details of each layer. So starting with the first layer which you are seeing here is the pigment cell layer. See here. So let me describe each of the layer. I am rubbing all these and I will explain it. Okay. See here. Now this is the first layer which you are seeing is the pigment layer, outer cell of the retina, pigment cell layer. Actually pigment cell layer is formed by cuboidal pigment layer of the retina. It is attached to the choroid, so just adjacent to the choroid layer. So what you can see, this is choriocapillary layer, just adjacent to it is the pigment cell layer. Okay, don't worry, I will read the I will write the contents also. Then we have got rods and cones layer, as you can see here. Then we have got the rods and cones are the very important for your bright vision and dim vision. Then and very nicely you can see the rods and the cones, which is exactly cylindrical. These are cone like, these are rod likes, and very easily you can identify these are rods and cone cells. Then we have got the limiting layer, external limiting layer or outer limiting layer. What you can see, this limiting layer, can you see here, this is the limiting layer. Okay, this is the limiting layer. Actually this external limiting layer is a junctional layer of complex formed between the Muller cells. What is Muller cells? It's a glial cells, means supporting cells, which is merging with the photoreceptors, that is cones and rods. Then we have got outer nuclear layer, which is containing the nuclei of rods and cone cells. Then we have got outer plexiform layer. After the outer nuclear layer we have got outer plexiform layer, which is again a synaptic layer between the, as you can see, this is a synaptic layer between the axons of rods and cones and the dendrites of the ganglionic bipolar neuron. Okay, sorry. So this is what, this is the bipolar neuron. This is bipolar neuron, and that this is a synaptic layer between the axons of rods and cones and the dendrites of bipolar neurons. Then we have got inner plexiform layer, which is also a synaptic layer. This is between the ganglionic cell layer, dendrites, and the axons of bipolar cells. After that, all the axons of the then we have got, after that when you will see, we have got the nerve fiber and internal limiting layer. So actually optic nerve fiber is the 9th layer, which is formed by the axons of ganglionic cell layer, and lastly the layer which you are seeing, that is the inner limiting layer, which is expanded end of the Muller cells. So let me write this detail because maybe you will forget it. So let me write in brief so that you can revise it. Okay, so all of you just write this details of all the 10 layers of the retina. So I will start from the first layer. So write down the topic detail will be layers of retina. So first layer, what is it? Pigment cell layer. Pigment layer. So pigment layer is formed by, it is cuboidal pigmented cell layer. It is cuboidal pigment cell layer attached firmly to, it is attached very firmly to the Bruch membrane of choroid. Then is the second layer. We have got how many layers, dear? We have got 10 layers. So let's move on the second layer. The second layer is layers of rods and cones. Layers of rods and cones. So when we talk about layers of rods and cones, it is consists of outer and inner segments of rods and cones, which is required for the dim vision and the bright vision. Then the third layer is external limiting layer. external or outer limiting membrane. Actually, when we are talking about this limiting membrane, this layer is consist of, this limiting membrane is in the form of junctional complex, and this junctional complex is made of Muller cells. Actually, what is Muller cell? It's a glial cell supporting network. So it is a junctional complex which is formed by the apices of Muller cells, that is glial cells, supporting cells, with that of photoreceptors, rods and cones, photoreceptors. So coming to the fourth layer now. The fourth layer is the outer nuclear layer. The fourth layer is the outer nuclear layer. The outer nuclear layer is consist of cell bodies of rods and cones. The fifth layer is outer plexiform layer. Outer plexiform layer is a synaptic layer formed by between axons of rods and cones with that of dendrites of bipolar cells. So this is a synaptic layer. What about the sixth layer? The sixth layer is inner nuclear layer. Now inner nuclear layer is made of cell bodies of bipolar cells. Got it? Cell bodies of bipolar cells. Now coming to the seventh layer. Now inner plexiform layer. Next is inner plexiform layer. Inner plexiform layer is again a synaptic layer. Synaptic layer where there is the synapse occurring between the axons of bipolar cells with that of dendrites of ganglionic neurons. Then coming to the eighth layer. Eighth layer is ganglionic cell layer. The ganglionic cell layer is made of multipolar neurons, ganglions. It's very easy to identify also. It will be of large size as compared to the bipolar cells. And the ninth layer is the nerve fiber. Okay. Nerve fiber, optic nerve. So I would like to show you that diagram once more. Can you see? Nerve fiber of optic nerve. So can you see here it is mentioned, actually all the ganglionic cell axons will join to form optic nerve fibers. So write down. Yeah. Nerve fiber of optic nerve which is formed by the axons of ganglionic cell layer. It is formed by the axons of ganglionic cell layer. And the last layer is the internal limiting layer or the membrane, and this is formed by the expanded basal end of Muller cells, which is resting on the basement membrane. So done with this, let's move on to the second MCQ. Which of the following ligament is not an extension of inguinal ligament? So actually inguinal ligament, when we will study, it is having few extensions which is named as which is given a particular name, whether it is pectineal, lacunar, Cooper's or transverse ligament. So you have to tell me which of the following is not an extension from the inguinal ligament. So actually the correct answer here is transverse ligament. Why transverse ligament is the correct answer? Rest all, that is pectineal, lacunar and Cooper ligaments, are actually the extensions of inguinal ligament. I will show you a diagram also for it, and I will write the name of extensions from the inguinal ligament. That will be easy for you to understand. So let's start with this. Okay. Now the first thing is that transverse ligament. So transverse ligament is also called as cardinal ligament. So why it is called as cardinal ligament? It is called as cardinal transverse cervical or McIndore's ligaments, which is giving support. It is an important, very important, most important ligament which is providing support to the uterus. Rest all ligament is extension from inguinal ligament. So see here, firstly in this diagram you can clearly view the inguinal ligament, and actually this inguinal ligament which is shown here is an extension from, anterior superior iliac spine to that of pubic tubercle. PT is here, this is pubic tubercle. So it is extending from anterior superior, inguinal ligament is extending from anterior superior iliac spine to pubic tubercle, and it is formed by the aponeurosis of external oblique muscle. Now this is inguinal ligament. Now you should also know what is the other name of inguinal ligament. It is also called as groin ligament and Pop-Arts ligaments, because when the MCQs has been made, they can just change the most commonly used name of the ligament and will give other names. So it is important that you should also know the other name of these ligaments. Now coming to the extension. So can you see here on the medial aspect? So I am just so this black color here I am highlighting this triangular structure. So if you can clearly see, so this I am highlighted. Can you see this triangular extension is called as pectineal ligament. Actually pectineal ligament is triangular extension from the inguinal ligament proceeding towards the pubic tubercle, and this is also called as the Cooper's ligament. Other name of pectineal ligament is Cooper's ligament. Okay, yeah. So yeah. So let me just tell you about this. So I just made a mistake once more, sorry. So please see here, pectineal ligament. So this is the lacunar ligament, okay. So this is lacunar ligament, okay. This is the lacunar ligament. So this triangular extension is lacunar ligament. My dear friends, this triangular extension is lacunar ligament, and from the lacunar ligament, this extension which is proceeding, that is called as the pectineal ligament, okay. So all of you please see once again this diagram, okay. So what is here? This triangular ligament which you are seeing here, this triangular ligament which you are seeing here, this triangular ligament is called as lacunar ligament, which is called as Gimbernat ligament, and from this the extension which is proceeded in upward direction going towards iliopectineal eminences is called as pectineal ligament, okay. So lacunar ligament is a triangular ligament which you are seeing here, which is attached to the pubic tubercle, that is also called as Gimbernat ligament, and from lacunar ligament the extension which is proceeding towards iliopectineal eminences, as you can see here, this is iliopectineal eminences, which is also called as Cooper's ligament, is called as the pectineal ligament. So lacunar ligament ka extension is pectineal ligament, and both are the extension of inguinal ligament. Few fibers which is traversing in upward direction and medially intermingling with the opposite side fibers is called reflected part of inguinal ligament. And one more ligament which is shown here, as you can see in the diagram, this one, which is a downward or inferior protrusion from the inguinal ligament towards the iliopectineal eminences, is called ilioinguinal ligament. So just write down the name of all these ligaments, okay. So inguinal ligament formed by the aponeurosis of external oblique muscle, also called as groin ligament or called as Pop-Arts ligament. Now forming the extensions, so write down the extensions of inguinal ligament are 4 important extensions are there. So 4 important extensions are there. One is Gimbernat ligament. Gimbernat's ligament. What is Gimbernat's ligament? Gimbernat's ligament is also called as Lacunar ligament. Okay, it's a triangular ligament which is attached to the pecten pubis, and from this triangular ligament extension going towards the iliopectineal eminences is called as pectineal ligament. It's called as pectineal ligament, which is also called as Cooper's ligament. Next is reflected part of inguinal ligament. Reflected part of inguinal ligament. If we talk about reflected part of inguinal ligament, this is the extension of inguinal ligament which is proceeded in upward direction medially and passing. This is passing in front of conjoint joint, and this reflected part of inguinal ligament traverses in front of conjoint tendon and behind superficial inguinal ring. Ilioinguinal ligament, it is a downward extension. Okay, ilioinguinal ligament is a downward extension from the inguinal ligament towards the iliopectineal eminences. So, ilioinguinal ligament. All these ligaments which I have written is the extension of inguinal ligament, but not the Macken-Dodds or transverse cervical ligament. So, which is a ligament of uterus, which is a most important ligament supporting the uterus and also called as cardinal or Macken-Dodds ligaments. Now, let's move on to the question number 3rd. So, yes, what is the nerve supply of marked structure in the image? So, firstly, you have to identify the structures which is shown here, and then you have to tell me which is whether it is a medial nerve, whether it is ulnar nerve, radial nerve or anterior introosseous nerve. Actually, the correct answer is A, median nerve. Why? Because this is the first lumbrical. What you can clearly see, these are the muscle in between the metacarpals and going towards the phalanges. So, this one which is marked with an arrow is the first one. So, yeah. So, let me give the explanation here itself. I am slightly enlarging it. See here. This fibers, as you can see, is unipinnate. These are first and second lumbricals. These lumbrical muscles are arising from the tendons of FDP. See here. This is the third one and this is the fourth one. All these muscles are arising from the tendons of which muscle? FDP, flexor digitorum profundus. All these lumbrical muscles are arising from the tendon of flexor digitorum profundus, and we know that first and second is getting innervation from median nerve. Third and fourth is getting innervation from ulnar nerve, and first and second lumbrical muscles are unipinnate, and third and fourth lumbrical muscles are bipinnate. So, clearly that is visible. Clearly you can see that is visible in the diagram. Third and fourth is bipinnate as shown in the diagram. Third and fourth is bipinnate. First and second is unipinnate. As you can see. So, is it okay? Let's move on to the next MCQ. So, let's move on to the next one, that is the question number 4. Okay, which of the following muscle is not supplied by marked nerve in the image? Okay, so you can see here there is an arrow marked nerve which is shown. So, which of the following structure is not supplied by the marked structure in the image? So, actually this is the cranial cavity, and by using this diagram I would want you to revise all the cranial all the important cranial nerves is emerging from which part of the cranial cavity as shown in the diagram. So, if it comes as a image based MCQ also, you should know it. Directly it can be possible they will not ask this identification, but they will give an MCQ framed of the topic. So, you have to firstly know the identification, then only you mark the answer right or wrong. So, here the other hint is that inferior oblique, medial rectus, superior rectus, तीनों के सप्लाई एक ही नर्व से होते हैं, ऑक्लोमोटर, यानी कि करेक्ट आंसर तो ऐसे भी सुपीरियर ऑब्लिक होगा, SO4 superior oblique by trochlear nerve. So, only one is the odd man out. So, in that context if you are not able to identify also, आप ये आंसर सही मार्क कर सकते हो in that way. But it is important that you should also want to identify the nerve. So, let me show this diagram in a large view, and I will identify all the nerves for you. So, this nerve which you are seeing, which is emerging from olfactory, this is an olfactory nerve, that is the first cranial nerve which is emerging from the cribriform plate of ethmoidal bone. This is optic nerve. Okay. This is the third cranial nerve or oculomotor nerve. This is the trigeminal nerve. This is the trigeminal nerve or fifth cranial. The small nerve is the fourth cranial nerve. This one is the sixth cranial nerve. Here this part which you are seeing is the seventh and eighth cranial nerve emerging from internal acoustic meatus from the jugular foramen. Below internal acoustic foramen, this is jugular foramen, that is 9th, 10th and 11th cranial nerve. This nerve which you are seeing here is the hypoglossal canal, and this is the 12th cranial nerve. Okay, so this is again trigeminal fifth cranial nerve along with its three divisions. This is O for ophthalmic, this is M for maxillary, and this is mandibular. Okay, so all this is this stalk-like structure which I would like to show you in green. This structure, what is it? This stalk-like structure which you are seeing will be the pituitary stalk. This artery is internal carotid artery. This is BA for basilar artery. This is BA for basilar artery formed by the two sides vertebral artery. Two-side vertebral artery joins to form the basilar artery. So all the important nerves can be identified in this diagram. This is very important for you, your identification of the nerves as shown in the diagram. Olfactory nerve, cribriform plate of ethmoid bone, optic nerve, optic canal, oculomotor nerve, the third cranial nerve, superior orbital fissure, also the fourth from superior orbital fissure. Trigeminal के three branches हैं, okay, ophthalmic from superior orbital fissure, maxillary from foramen rotundum, mandibular from foramen ovale, 12th is from hypoglossal nerve, 12th hypoglossal nerve from hypoglossal canal, 7th, 8th is from internal acoustic meatus, 9th, 10th is jugular foramen. So in short, we have revised all. Let's move on to the next MCQ. What is the feature of the muscle highlighted in green color? So you have to identify the morphological feature of the identified muscle in the green. So actually this muscle is pectoralis major and very easy to identify. So can you see it has a wide origin, as you can see from the sternum, clavicle, but the insertion point is narrowed out and it is twisted at the inserting point. So this is a pectoralis major muscle inserting into the lateral lip of intertubercular sulcus, and this is an example of spiral or twisted muscle fiber. Actually, it is also important that this is an MCQ from the general anatomy, that you should also be able to identify the muscle according to its morphological aspect, like circular. जब हम circular muscle की बात करेंगे तो it is orbicularis oris, orbicularis oculi. Example, multipinnate deltoid muscle, bipinnate the third and the fourth lumbrical rectus femoris muscle, dorsal introccei muscle, unipinnate palmar introccei muscle, first and second lumbrical muscle, pallar sartorius muscle, fusiform muscle, biceps muscle, convergent muscle, pectoralis major muscle. So major types of the muscles, also all the major types of muscle fibers which has got different muscle fiber arrangements, you have to know the example of each one of it, because it is also a favorite question for your NEET PG entrance examination. Now let's move on to the next, that is question number 6. All of the following forms the boundary of marked area in the image except. So you have to identify that triangular area which is shown in the blue color, and you have to tell me all of the following structure are the boundaries except. So your so mark the correct answer. The correct answer is superior vena cava opening. Actually this marked triangular area is which triangle? Koch's triangle. Triangle of Koch. So now see here, this is triangle of Koch, and here you can clearly see the boundaries of triangle of Koch. Here you can clearly see the boundaries. So what you can appreciate, this triangular area, it is bounded by tendon of Toledo superiorly here, tricuspid valve anteriorly, coronary sulcus opening is here. This is the coronary sinus. This is the coronary sinus opening which you are seeing. This is lying postero-inferiorly. These are the boundaries of Koch triangle, and the structure located inside is the AV node. Not superior vena cava is forming the boundaries. One more cadaveric image diagram which is clearly showing you the boundaries of triangle of Koch. This whole area which has been shown in this diagram is the triangle of Koch, which is a very important anatomical area interior of the right atrium, which is containing coronary sinus. Here the other things which can be shown here, this opening is coronary sinus bounded postero-inferiorly, anteriorly by the tricuspid valve. Tendon of Toledo is superiorly, and it contains what? It contains AV node. It contains the location of AV node. Now, extensor compartment of the wrist means which compartment? Third extensor compartment. Actually, the third extensor compartments, so below the extensor retiniculum on the back of this forearm close to the wrist, at this area there is extensor band, and the structures traversing at the extensor tendon which is kept together because of this extensor retinaculum band, and this extensor retinaculum is giving septas which is dividing the interior into 6 compartments. 5 septas are there, and the structures traversing from the third compartment is extensor pollicis longus. So it is important that you should know all the structure passing through each compartment. So quickly we will make a diagram for it. So this is U and this is R. U for radius and R for radius and U for ulna. Sorry. Yeah. Now let's see here. This is the. So what I have made here is the compartment. Okay. So this is just a schematic diagram to show you the extensor compartment. So extensor compartment. What we are making is the extensor compartment. It is important for us to know the structures traversing through each compartment. So first, second, third, fourth, fifth and sixth. Okay. So this is the first, this is the second, this is the third, this is the fourth, this is the fifth and this is the sixth. So structures traversing from each compartment. To 2 muscle tendons from the first, also 2 from the second, from third only 1, from the fourth 2 muscle tendons, and fifth and sixth. Let's write the name of each muscle traversing, each muscle which is traversing. So we have got abductor pollicis brevis and extensor pollicis brevis from the first compartment. We have got ECRL, extensor carpi radialis longus, extensor carpi radialis brevis from the second, extensor pollicis longus from the third, extensor digitorum from the first, below it is at the extensor indicis, extensor digiti minimi from the fifth, extensor digiti minimi from the fifth, and extensor carpi ulnaris from the sixth. Other than that, fourth compartment say posterior intraosseous nerve and anterior intraosseous artery bhi jata hai. So actually 4 structures passes from the fourth compartment, posterior intraosseous nerve and anterior intraosseous artery also. So in quickly we have seen the 6 compartments lying below the extensor retinaculum and the extensor tendons which is traversing through this individual compartment has been shown. Moving on to the next one, that is question number 8. Ligation of common hepatic artery will compromise blood flow in which of the following? Right and the left gastric arteries, right gastric and short gastric arteries, right gastroepiploic artery, short gastric artery, right gastric artery and right gastric and right gastroepiploic artery. So mark the correct answer. Your time begins now. So yes, the key point is common hepatic artery ligate है, यानी branches of common hepatic artery के blood supply affected होंगे. So the answer is right gastric artery. Short gastric artery is branch from splenic artery. So this can't be the answer. This can be answer. Left gastric artery is an individual artery. It is not. It's a direct branch from celiac trunk. It's not a branch of common hepatic artery. Right gastric artery is sometimes arising from common hepatic artery or proper hepatic artery. Both sources are there. So common hepatic artery के ligation से blood flow to right gastric artery can be affected. Gastroepiploic artery right is a branch of gastroduodenal artery, and gastroduodenal artery itself is a branch from hepatic artery, common hepatic artery. So D is the correct answer. I would like to show you this diagram for it. See this diagram here, you can see this is the common hepatic artery branch from celiac trunk, which is again giving proper hepatic artery, which is giving branch right gastric artery and right and the left hepatic artery. From right hepatic artery other branch is cystic artery. It is also giving gastroduodenal artery, which is again giving 2 branches. One is right gastroepiploic artery, another is superior pancreatico-duodenal artery. So all the branches has been elaborated here. Got it? Now let's move on to question number 9th. Question number 9th A 56-year-old man comes to the hospital with abdominal pain, jaundice, loss of appetite and weight loss. On examination, his radiogram, CT scan, physician finds a growth of tumor in the uncinate process of the pancreas. So, which of the following is most likely to be compressed? Question number 9th. Answers are splenic artery, portal vein, superior mesenteric artery, superior pancreatico-duodenal artery. The key point which is mentioned here is the tumor growing in the uncinate process of pancreas, and the correct answer here is superior mesenteric artery. Let me show you the diagram for this. So, see here, this part which you are seeing is the uncinate process. As you can see, this part is the uncinate process, and here we have got a relation of very important arteries and vessels. As you can see, superior mesenteric artery and vessels are directly related with the uncinate process of the pancreas. So, this is the correct answer. Let's move on to the next MCQ, that is marked ligament is attached to following structure except. So, that means you have to identify the marked ligament and then you have to tell me which of the following structure is not attached to this marked ligament. Options are medial cuneiform, medial malleolus, sustentaculum tali or the spring ligament. Your time begins now. Question number 10, mark the correct answer. So, the correct answer is A, medial cuneiform, and the correct ligament is deltoid ligament. This is deltoid ligament which is shown in the diagram. Actually, deltoid ligament is also called as medial ankle ligament. It is also called as medial ankle ligament, and we have to know about the attachments of medial ankle ligament. So, see here. Now, what you can see, this is the medial ankle ligament which is shown in the diagram, and this part is MM. What is MM? MM ka matlab medial malleolus. Medial malleolus. Medial malleolus means lower end of tibia. Lower end of tibia. So, the common attachment of medial ankle ligament or deltoid ligament, superior aspect is medial malleolus, but at the lower aspect it is diverging. So, you can see it is diverging in 4 direction, and these parts I would like to show you. One is diverging here posteriorly towards the medial tubercle of the talus, and the other is called as the anterior tibiotalar part. See here. So, this is anterior tibiotalar part, this is the medial malleolus ki taraf jo ja raha hai, this is the posterior part. See here. So, it is going towards the talus bone, that is clear here. The other extension which you can see here is the calcaneum. What you can see, it is going towards the calcaneum. This part which I am highlighting in blue color, you can see it is going and merging to the sustentaculum tali, which is a self-like projection from the calcaneum bone. So, see here, this is the tibiocalcaneal, this is tibiocalcaneal. So, let me use green color for the talar attachments lower down, and this is the tibiocalcaneal attachment, sustentaculum tali. Now, the other extension of this ligament which I am showing with pink color, this is called as the tibionavicular. Tibionavicular is merging with the tuberosity of navicular bone, and lower down, as you can see here, lower down it is also merging with the other ligament that is called as plantar calcaneonavicular ligament. So, actually the other name of plantar calcaneonavicular ligament is spring ligament. Spring ligament. So, yes, that means this ligament is having following part. As you can see in the diagram, it is merging. The lower attachment of the medial ankle ligament is attaching to the navicular bone, tuberosity, sustentaculum tali of calcaneal, medial tubercle of talus, and also to the spring ligament, not to the medial cuneiform. So, medial cuneiform is the right answer. So, before ending the session, I would want to give you once again the information about my live free session. All those who are watching my session on the YouTube channel, please do join my live free sessions on the Unacademy, going to take place on Wednesday 7:30 p.m. So, unlock code is ANAT10, which can be used by you. This is the code which can be used by you, unlock code ANAT10, those who are downloading the Unacademy app for the first time. And this is the schedule of my session. So, my session will be on 7:30 p.m. Wednesday, that is, it is going to be on 11th August, Wednesday 7:30 p.m. A clinical anatomy MCQ series 5th, extremely beneficial. Do join free live session on the Unacademy NEET PG platform. Thank you. So, again we will meet on the Sunday with the second episode of the common mistakes and the discussion of commonly asked MCQs targeting NEET PG 2021. I am Dr. Monalisa, educator of anatomy subject on the Unacademy platform. Thank you so much. Thank you. All the best, students.